So what exercises can you do during your first trimester? What exercises are beneficial for your pelvic floor, for your core during the first trimester? As a pelvic floor occupational therapist and a pelvic floor physical therapist, these are questions that we hear all the time from mothers or women who are trying to conceive, for moms who are in the first trimester, or moms who are preparing for a future pregnancy. During the first trimester, it is really hard for most women to do anything. It is very hard to move around. Some women are just simply in survival mode, just trying to be able to do their day-to-day, go to work, care for other kiddos. So while I totally understand if you are the mom who is like, I can't even think about exercising, I want you to change your perspective from like traditional exercise during pregnancy to more of intentional movement for your body that's going to prepare your body for labor and delivery and postpartum healing. So when we think about first trimester and pregnancy exercise in general, I think it's very important to make sure that we aren't like, oh, you have to be exercising 7 days a week in order for your pelvic floor and your core to be in a good position for labor and delivery or postpartum. It's more about finding the appropriate exercises and movements that are going to benefit you and also help you feel better during each trimester of pregnancy into postpartum. During the first trimester, there are quite a few exercises or techniques that we try to implement here at Mommas in Motion with our clients. And Morgan is going to go through, she's going to explain and demonstrate on me some of the exercises that we prioritize with our first trimester clients.
We are going to come onto hands and knees. Sometimes this is called quadruped or tabletop. It's really important when you're in this position to start with a stable foundation even before you begin the breathing. So sometimes people kind of, yes, thank you, arch their back, or the opposite, and they have their butt up in the air, and both of these are just like not great. Exactly. So if you come and bring your shoulders and hips neutral and push out of your wrist, so if you can sag your shoulders again, kind of come down and then push out of your wrist, you can see that now we're at a much more even like tabletop position. There will be some bend in your spine. You're not literally a table, and our spine is meant to curve a little bit, so it's okay for some. We just don't want those over exaggerated postures. So then when we get into breathing, for diaphragmatic breathing, it's important to understand that we will be breathing in through our nose and out through our mouth. Jamila, what I'm going to have you do is as you inhale through your nose, we're going to feel our belly expand. And so in quadruped, it's really nice because sometimes when you're on your back or on your side, it's easy for your chest to do a lot of the work. Luckily, when you're on your hands and knees, your arms are trying to just hold you up. So luckily that expansion downwards and allowing gravity to feel your stomach lower towards the ground is really nice. So let's just start there. Let's not overthink this too much. Let's just focus on that inhale. And can I place my hands on your ribs?
Yes.
I want you to think about not only your belly expanding towards the ground, but this 360 expansion. Your ribs are actually going to expand to a full breath, like you're blowing up a balloon. Good. Let's do 2 more, just like that. So as you can see, her ribs are expanding and her belly's expanding. It's not just this like straight shot down. That's just not how our body works. Also important to note with breathing is you're not forcing. So you're not inhaling so much that you're holding your breath at the end or like pushing air into your belly. This may be new for you. If your breath is a little more shallow to begin with and that's what's comfortable, that's okay. Start there. Do not hold your breath. The next part of this breath, once you kind of get comfortable with that inhale, is as we exhale, you're going to think about tucking your baby up and in. Now, depending on where you're at in first trimester, everyone kind of shows at different times and has that feeling at different times. And so tucking baby up and in can be a good cue, but also thinking of a zipper from the bottom of your pelvis up can be a good cue as well. So as you inhale, expanding, and then exhale, we're going to tuck baby up and in. Good. Inhale. Good. Tuck baby up and in. Now notice how it's her core, her abdomen, her belly doing the work. She's not utilizing her hips to make her belly go up. Exactly. It's actually just the breath doing that control. And this breath can be, again, such a good exercise because as we go into second and third trimester, we utilize connecting your breath to help you when you're doing functional movements with that increased weight in the front. It's also helpful for labor and delivery prep when we talk about pushing positions and laboring positions. So really great thing to kind of get locked down. And like I said, if this is the one thing you can do in a day, this is amazing. You're doing an awesome job. Another great position that you can do diaphragmatic breathing and that tucking baby up in and activation is tall kneeling, which is going to look like coming up on your knees. This can be a little bit easier if you're having some shoulder or wrist discomfort while you're in the hands and knees position. It's going to be the exact same thing. As we inhale through our nose, we're going to feel that diaphragmatic breath expand our ribs, expand our belly, like a wave going out to shore and coming back in. It's a 360 motion, not just a straight line. Then after you inhale, you're going to do a more forceful exhale and tuck baby up and in. Here you can see it's not a crunch forward or using those upper abdominals. It's really starting from the bottom and you're tucking that baby up and in like a gentle hug. So something you can also do if you find that you tend to breathe more into your chest is place a hand on your chest and on your lower belly, your lower abdominals. And that can cue this hand saying, chest, you can chill out, you don't need to move. Lower hand saying, breathe into me, expand, and help tuck that baby up and in. With breathing, do not get discouraged if the first time you do this, or even after you've practiced several times, the first couple of breaths feel a little funny or don't feel like your best work. I've been doing this for a long time and so has Jamila, and even myself, when I show clients this, I have to get 3 or 4 reps in before I really feel like I'm getting that full inhale expansion and that activation with the exhale. So show yourself some grace, and the best advice I can give is not to do one breath, then stop because you messed up and then try starting again. It's just a flow. If that first couple breaths aren't great, that's okay. Just keep going and doing a few more breaths till it feels good, and yeah, you'll find your rhythm. So another great exercise, if you're feeling up to it in that first trimester, is bird dog. This is an amazing exercise because it honestly works your entire body and it can be scaled up and down. So we'll start by showing what a full bird dog looks like, and then I'll show you some modifications for those days that just not feeling doing both an arm and a leg. That's okay. Again, the whole goal during pregnancy is figuring out your body's boundaries and learning how to scale up and down and respect that. So for a bird dog, always going to be connecting to your breath. You'll hear this a lot all throughout your pregnancy. I want you to, before you lift an arm and leg, to take an inhale and exhale and tuck baby up and in, set that core. Good. Now that the core is set, I want you to still keep breathing. We're not holding our breath. Little inhale, and on the next exhale, you'll lift your left arm and your right leg. Beautiful. Inhale, arm and leg come down. Good. And then exhale, right arm, left leg lift. Now, something important for this position, especially if this is your first time doing something like this, is that setting the core, tucking baby up and in, you might need to do between each time you lift your arm and your leg. So if you feel like after that first time you lift your arm and your leg that you lose your core, you kind of feel that looseness and your belly expand towards the ground, go ahead, take a second, do that full diaphragmatic inhale, and exhale, tuck baby up and in, reset that core. That's how you're going to learn how to protect your body through your pregnancy. Awesome. The other thing with the bird dog, and we can go down and do just legs, so this is one way that we can do the modification, is just doing the legs. You don't want to kick your leg out to the side like a fire hydrant, any sort of ways. Our spine, our trunk, stay still. It's just the leg moving. So your leg doesn't have to go up way above your hip. It's just going out enough that it fully extends and then coming back. Extending meaning your knee's not bent anymore. So same thing here. You're exhaling as you lift your leg, inhaling as your leg comes down. And even in this position, it can be easy to lose that activation, that tucking baby up and in. So don't feel bad if you have to reset your core, even in this position. The next modification is to just do your arms. So same thing, inhaling and exhaling, setting that core, tucking baby up and in. Exhale, arm lifts up. Inhale, arm goes down, and then alternating. Exhale, left arm goes up, and inhale, it comes down. And so you can do the full bird dog, you could do just arm and legs, one after the other, or you could just pick to just do the arms or just do the legs that day. That's what's beautiful about this exercise. You get so much, and this is exactly what we're talking about earlier, where you don't need a 30-minute to an hour workout in that first trimester to do so much good for your body. The next exercise I'm going to show you is, or that Jamila is going to show you, is a cat-cow. This is an amazing exercise to coordinate your breath with, to get some mobility, meaning some stretching, some lengthening that your muscles are going to be craving. And so what we'll do is, again, coordinating with our breath. As you inhale, your belly will come towards the ground, head comes up, and hips come up. Then as you exhale, that very similar tucking baby up and in, except we're getting a little bit more arch with the spine here. Inhale, belly comes down towards the ground, beautiful. Exhale, back arches towards the ceiling. Now notice how this isn't a super crazy fast movement, it's not over exaggerated, it's very slow, very controlled, and you should be able to feel a stretch, feel that coordination with the breath. If you're not, you may be doing it a little bit too fast, or you may be over exaggerating that movement. Awesome. I talked a little bit about how like that 7 days a week, like there is this transition into pregnancy, and that first trimester can be this like awakening of, oh my gosh, maybe I have to have some new boundaries with my body, and that can be really difficult. That's where I see people kind of go like, I need to do all the movement or none of the movement. And I think the things that we're going to show you that there's really loving things you can do for your body that are going to set you up for so much success when you go into second trimester, when you get into third trimester, and even thinking about what can I do during pregnancy that will set me up for a better postpartum that doesn't have to look like 30 minutes to an hour of intense movement. And I really think pregnancy kind of has this beautiful way of teaching us how to respect our body's boundaries, and how movement, exercise, it doesn't look the same for every body. It doesn't even look the same every day. And so even as you're watching some of these, if like the breathing is what you can do that day, that is so good. That's amazing. Mm-hmm. And like you should be proud of yourself for that. So